This module will focus on how to choose a treatment for sick kidneys. In this module, we will talk about what is important to you when you and your family need to make a decision about choosing a treatment for when your kidneys are not doing the important jobs for your body very well. It is important to know all that you can about the treatments available to you so that you can make the choice that is best for you. We will end with a simple list of treatment choices that are available to you. These treatment choices will be talked about in upcoming modules. While there are many things to think about when making decisions, 3 important things stand out. What kind of lifestyle do you want? What do you need to think about? What do you feel is important for your health? What is important when you think of your partner, family, and friends? There are many things to consider when deciding about treatments for end-stage kidney disease. Everyone is different, and so it is important that you and your family talk about what is important to you. It also helps to write down your thoughts and take these with you to talk about with your kidney care team. Some of the lifestyle things to consider. Do you need or want to work or go to school? Do you want to lead an active life and continue with fishing, hunting, playing sports? Do you want or need to travel? Do you want to be in charge of your life and not have anyone else tell you what to do? Do you want to be able to do things for yourself? Some treatments for kidney failure do not allow you to swim in a lake or take tub baths. Is this important to you? Are you afraid of needles? Do you want to be able to eat and drink more freely? Does where you live make a difference? Do you want your home to be your home and not a hospital room? All of these questions are important to think about when considering your treatment choices. Besides lifestyle changes, people need to consider their present health and other health conditions they may have when choosing a treatment. How do you sleep at night? Does taking too many pills upset you? You need to know the side effects of the medication and treatments you are taking. Do not be afraid to ask your kidney care team about these side effects. You have a right to know. Do you want to have the best chance of living longer? What kind of quality of life do you want? Do you want to have the best chance of getting a kidney transplant? Do you want to be at home, in your community, rather than in the hospital for treatments? Do you want other people to take care of you? How will your diabetes, heart disease, asthma, arthritis affect your treatment choice? Your partner, family, and friends are important to you, so there are things that you need to consider with them. You would like to have children. How does this affect your choice? You have no one to support you. Will you be okay by yourself? You don't want to be a burden on your family. You really need to take care of your kids, your grandkids, your mom, and dad. What option is best for you? You want to continue with your sex life. What is the best treatment that will allow you to do so? Talking about these decisions can be tough. You don't want to burden your family or friends. You are afraid to bring up your health. You suffer in silence. Finding time in this hectic world is tough. Sometimes you need a guide. Reach out and ask a trusted family member, a friend, an elder, a spiritual advisor, a special member of your kidney care team. Treatment choices for kidney failure can include conservative kidney care, the focus is on quality of life for the time you have, rather than on trying to live longer. Dialysis, of which there are two options: peritoneal dialysis and hemodialysis. Kidney transplant. Hemodialysis, peritoneal dialysis, and kidney transplant are treatments for people who have kidney failure. It is important to remember that these are treatments and not cures. Each of these treatment choices will be talked about in more detail in the upcoming modules. In this module, we talked about what is important to you when you and your family need to make a decision about choosing a treatment when your kidneys are not able to do the important jobs for the body. We ended with a simple list of treatment choices: conservative kidney care, dialysis, and kidney transplant. These will be talked about in the upcoming modules. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.